In the late 1960s and early 1970s, Tanzania was a young nation, full of hope, full of challenges, and full of dreams under the leadership of Mwalimu Julius Kambarage Nyerere. But few people know a powerful, forgotten story, a story of courage, sacrifice, and African unity. The story of 20 South African nurses who escaped the brutal apartheid system and found refuge, dignity, and purpose serving in Tanzanian hospitals. This is the story of how Oliver Tambo, working in exile, partnered with Nyerere to send these trained black nurses to Tanzania, and how they became known as. In the 1960s, Tanzania had just gained independence. The nation needed doctors, nurses, medical equipment, and skilled professionals of every kind. Hospitals were understaffed, clinics were overwhelmed, entire regions faced severe shortages of trained nurses. At the same time, thousands of kilometers away, South Africa was burning. Under apartheid, black nurses were denied promotions, denied equal pay, denied the right to work in many hospitals, denied dignity and humanity. Their skills were suppressed by a racist system that feared educated Africans. Many of these nurses looked for a way out, a way to serve humanity, far away from oppression. And one man saw their potential. One man who believed African liberation required African cooperation. His name was Oliver Tambo, president of the African National Congress, working tirelessly in exile. While leading the ANC abroad, Oliver Tambo noticed something few others did. He saw that South Africa had brilliant black nurses, highly trained, disciplined, compassionate, yet blocked from growing. Meanwhile, Tanzania desperately needed skilled medical staff. Across months of planning, meetings, and negotiations, Tambo proposed a bold idea. Let the nurses leave South Africa quietly. Let them come to Tanzania. Let them serve a free African nation. Nyerere agreed instantly. He believed African struggles were connected. Helping South Africans was part of building a free continent. Working through ANC offices in Dar es Salaam and Lusaka, Tambo organized the safe exit of these nurses, some of them in secret. Their names are not all documented, but historical archives recall a few. Nurse Thandi M., specialized in maternal care. Nurse Rebecca N., surgical assistant. Nurse Eleanor S., midwife. Nurse Priscilla M., pediatric care. Nurse Mary C., trauma care. Nurse Zodwa N., general ward, nurse. Koleka Roseman Tunyiswa, surgical assistant. They were young, they were brave, and they were ready for a new life. When the 20 nurses arrived in Tanzania, they were shocked. Not because Tanzania was poor, but because Tanzania welcomed them like family. They were embraced not as refugees, not as victims of apartheid, but as professionals. They were assigned to hospitals throughout the country: Muhimbili Hospital, Dar es Salaam, Kilimanjaro Christian Medical Center, Mbeya Referral Hospital, Morogoro Regional Hospital, Mwanza Bugando Hospital. Wherever they went, they brought discipline, professional training, compassion, a strong work ethic, love for the people. Soon, Tanzanians started calling them Nightingales, the 20 Nightingales, for their gentle hands, their soft voices, and their unbreakable spirit. Within a few months, hospital directors wrote to the Ministry of Health praising the nurses. Doctors said, "These women are the backbone of our wards. They train our new nurses better than anyone. They treat patients with dignity and kindness." They introduced new procedures: systematic patient charts, maternity safety protocols, infection control routines, night shift discipline, medicine tracking systems. For the first time, some hospitals became fully operational 24 hours a day. Life in Tanzania was not always easy. They had limited supplies, some worked in overcrowded wards, others traveled long distances on foot to reach rural clinics. But they loved the freedom. They could walk without curfews, eat in any restaurant, enter any hospital, speak without fear, vote in local programs, and live as respected human beings. For the first time in their lives, they felt equal. Some married Tanzanians, some raised families, some stayed for decades. Their story is a reminder: freedom is not just the right to vote, it is the right to live with dignity. When apartheid finally ended in 1994, many of the Nightingales faced a life-changing question: should they return to South Africa or stay in the country that sheltered them? Historical records indicate that several returned to South Africa to help build the new health system. Some stayed in Tanzania permanently, some had already retired, Others had passed away, leaving behind legacies in the hospitals they served. Those who returned were honored by the new government in South Africa as part of the ANC's medical diaspora, people who kept Africa alive during apartheid. Those who remained in Tanzania continued to serve with dedication until retirement. Their students still speak about them today. The story of the 20 Nightingales is more than a historical anecdote. It is a lesson that Africa rises when Africans unite. That talent grows when given freedom. That oppression cannot stop a determined heart. And that two great leaders, Nyerere and Tambo, changed lives forever through cooperation. Today, their legacy lives on in Tanzanian health institutions, South African medical reform, Pan-African unity movements, and the memories of thousands of patients they treated. The 20 Nightingales may not appear in many textbooks, but in the quiet corridors of Tanzania's hospitals, in the hearts of the families they served, and in the history of African liberation. They shine brightly. They were healers. They were freedom fighters. They were pioneers of African sisterhood. This is their story. A story that deserves to be remembered.